Good evening, everyone. It's Wynn Brown from Heywood Healthcare with a COVID-19 update for today, which is Wednesday, January 27th. Gosh, the time is flying by. Just a few updates for you today to keep you up to date with what's going on. First, around COVID vaccination in our region. We are conducting 2 phase 1 clinics this week. So phase 1, and the group is that is eligible for that, which is really healthcare workers and patient-facing workers in our region. That's on this chart, so you can see that. So we have a vaccination clinic at Athol Hospital tomorrow, 7 a.m. to 10 a.m. and Monday, 10 a.m. to 12 p.m. at Heywood Hospital in the cardiology department. Again, you have to be a phase 1 person to be able to sign up at this point in time. So we have to follow the state guidelines. And we've seen some people sign up that aren't quite eligible yet to do that. So please do not go in and sign up until we invite you for phase 2, which will begin on Monday across the Commonwealth. Whether we're going to be able to stand that up quickly enough or have enough vaccine is to be determined. We're getting tons and tons of calls about, can I get a vaccine? Can I get a vaccine? As soon as we're able to really do that, we will, and stand up something more permanent for our region, we will definitely let people know and do our best to make sure that it's easy to access. So those 75 and older can get the vaccine beginning in phase 2. But remember, we just have limited capacity. We're going live with a new electronic medical record on Monday, which, if any of you know anything about healthcare, is an incredibly huge 3-year lift we've been working on. And so I know there's a lot of chatter out there in the community. People think that other people are getting vaccines and all that. Please don't worry about those kinds of things, because usually people don't have all the facts. So just, if you can get the vaccine somewhere else right now, good for you, but we will stand things up as soon as we can to make sure that we increase the access as we come into phase 2. But again, we don't really have much vaccine on hand, which, if you've been following the state and national news, it's an issue everywhere. And we're trying our best with all the things that we're also trying to do for the community to stand up a regional vaccination clinic and clinics coming up shortly. So please be patient. Don't call your primary care physician to try to get one. You can't do that right now. Don't call the hospital. We will let you know and communicate with you proactively when we can open up to phase 2 for the community for those 75 or older. So again, appreciate your patience. Sorry to be preachy, but there's a lot going on to make this all happen, and just trust us that we're going to do the best job we can for our region to get that up. And I know everybody's anxious, and I understand that. Let's just look at Heywood Healthcare census. We are back up to 26 COVID positive patients across the system. So, up near the top of where we have been historically. 4 of those patients are in our ICU. Our 7-day positive rate remains high, averaging 7.55% over the 7 days prior. The state sits below us at 4.77. So again, we want to get the vaccine out, but we also need everybody to do everything they can to be safe and socially distanced, not let your guard down, wash your hands, wear your mask, do all those right things. If you have children and adolescents living in your home, where we're seeing a large number of them, please make sure that you are counseling them and giving them the best advice, and for lack of a better term, managing your kids so that they do not get exposed and then bring it home. So enough of the dad in me. That's a lot of dad stuff this morning, being really preachy and telling you what I think, but that's kind of the way it is right now. It's really stressful for us and a lot going on. So appreciate you helping out where you can and being patient, knowing that we are going to deliver like we always do for North Central Mass and the Quabbin. So I'm going to close out with some really nice words that people have been sending in, just so our staff, the majority of those of you who are watching, know that the community is appreciating what we're doing. First, to all the staff, thank you for being there for us. Great job, everyone. Thank you from the bottom of our hearts to all the staff and personnel, those on the front lines and those behind the scenes, all working diligently to keep everything running smoothly, treating, healing, and helping individuals and surrounding communities to be as healthy as possible. Incredibly grateful that Heywood is our home hospital, I should say, and Athol, sending prayers to all for health and blessings to come in 2021. Thank you for all you do for your community. Truly, #Heywood Strong. Extremely grateful to Dr. KP and his dedication to his patients. So thankful for this man and the entire staff of the ICU. A true champion, Dr. KP. Have a great evening, everyone. Thank you for all you're doing to support us as we continue our journey to serve you as one of the best community-owned health systems in America. Have a great evening.